Welcome to Prepared for Parenthood, the podcast for hopeful, expectant, and new parents with little ones up to age 5. I'm your host, Dr. Stephanie Duger, a psychotherapist, author, educator, parent coach, and married mother of 2. On this show, we'll discuss everything from the most up-to-date practicals of best supporting your young children, to thriving in relationship as a family, more surprising topics around the psychology and development of babies from conception through age 5. So sit back, relax, and enjoy. I'm thrilled to have you here today. Welcome back to Prepared for Parenthood. Today, our guest is Lynn Schulte, a pelvic health physical therapist for more than 30 years. Lynn is a principal instructor and founder of the Institute for Birth Healing in Longmont, Colorado. She has successfully helped thousands of women heal from all issues experienced after birth, including a common birth pattern she found that shows up in the pelvis postpartum. Lynn also teaches courses to body workers to help them work with the energy of the body and access and use their intuition in their bodywork sessions. Knowing we are more than just our bodies, Lynn works on all levels, physically, energetically, and spiritually, with women to help them access their full potential. She offers a certification process to help birth professionals become birth healing practitioners. Welcome, Lynn. I'm so happy to have you here today.
Thanks, Stephanie. I so appreciate any opportunity I get to share what I know, because it's so important that, especially for women and moms, pregnant people and postpartum people, they need this knowledge, they need this understanding, they need support. And I love sharing what I know about the body.
Well, what do you see in your practice? What are the most common issues for women during pregnancy and postpartum, and even maybe years after postpartum?
Yeah. So during pregnancy, I'd say the most common is pelvic pain, back pain. And doctors, OBGYNs, they're just like, yeah, that's a normal part of being pregnancy. And they brush it off. And what I want pregnant people to know is that pain is a sign that there's a dysfunction somewhere in your body. And when that back pain is in your sacroiliac joint, which is the dimples in your low back, right where the sacroiliac joint is, and that is the major joint for birth, for that baby coming out. And so I would love to do a study on women who have back pain and how their labor goes, to see if there's any correlation. And if that's the hinge for birth, I wanted to make sure that it works well for the baby coming out. And so while back pain and pelvic pain are big issues that a lot of women have during pregnancy, I think the bigger issue that I would want pregnant mamas to know is that what you bring in your body to your birth is what can impact it. And what I mean by that are previous injuries, previous surgeries, previous falls, appendectomy. If you've had an appendectomy at any point in your life, even as a child, you have scar tissue in your lower right side of your abdomen. And I always, 100% of the time, find that the uterus is tight on the right-hand side because of that scar tissue. And baby will then grow and only inhabit the right side of the belly. So for pregnancy, I want moms to know that your baby should be able to inhabit both left side and right side. And if your baby is only hanging out on one side of the body, that may be a sign that there's a restriction going on. And so I want moms to be more aware of the positioning of their baby and where their baby can go in their body, because the baby only can go where there's space. So the baby tells you where they have space, and where they don't have space is where they're not going. There are things that we can do that can release tight structures. I like to think of the uterus as those parade balloons, that the people are walking along the street holding the strings to allow the balloon to float up in the air. Our uterus is very similar to that, in that we have ligaments. We have round ligaments, uterosacral ligaments, and we have broad ligaments. And those are the balloon strings holding that balloon upright. And if we have tension on one side, it's going to cause that balloon to tilt to that tight side. And then that baby is going to grow in that direction and only be able to inhabit one side of the belly. And that can contribute to some of that back pain. or pelvic pain or round ligament pain. That's probably the third most common is the round ligament pain. An occasional twinge of the round ligament, that's okay. That could just be the baby adjusting or moving in your belly. But if you have a constant round ligament pain that's always happening on the one side, that's a sign it's in dysfunction. And I'm just amazed at how much space and room we can give babies after releasing the uterine ligament. But it's like adjusting the strings of those floating balloons in the parade to make it even again so that the uterus can be even and baby can grow and move wherever it needs to get into the best position to come on out. And this is something that I don't feel a lot of OBGYNs are familiar with, this idea that we can make these adjustments and we can change the baby's position. There's more to just looking to make sure a baby's head is down into the pelvis. It can be down, but it can be heading into a hip. And so I'm looking to make sure that baby's head is directly midline, that it's even from side to side so that baby and the uterus doesn't have that much work. Think about how many hours of labor it might take for the uterus to contract to try to get baby into the midline when we start in the hip. So what my goal when I'm working with pregnant clients is I just want you to have as smooth and as quick of a birth as possible. Let's take a couple of hours of your labor away by helping to make sure that your uterus has good mobility side to side, the uterine ligaments are released, and baby can get into the best position to come on out. So that's my approach for pregnancy. The other huge, most important, but it's really helping women to figure out how to push effectively. I do intravaginal work. I work inside the vagina with the pelvic floor muscles and the other structures in there vaginally. And after I get done releasing the pelvic floor muscles, if I'm working with a pregnant mama, she'll be on her back and her knees are bent up. And I have my fingers in vaginally and I'm pressing deep back in where the baby's head is going to come through. And so I'll say, if you don't have an epidural, this is where you're going to feel the baby's head coming through. And that might feel like you have to poop. And that's a very good sign, actually, that the baby's getting close to coming on out. And so then I'll say, okay, push my fingers on out. What would you do to push your baby on out? And they go to push a baby on out, but they're tightening their pelvic floor muscles. When you tighten your pelvic floor muscles, when you're trying to push a baby on out, you're fighting yourself. You're resisting that baby coming out. What I'm looking for is a lengthening and a pushing out of my fingers. And so I don't spend a lot of time with someone on their back because I have found that is the hardest position to push in, to figure out how to push in. So then I'll get someone on their side and we'll practice pushing and side lying. Then I'll get someone on hands and knees and we'll practice pushing in hands and knees. And then by the time we get them up into tall kneeling, they're like, oh, I get it. Because it's just like pooping. So if you are constipated, what do you do to get the stool out when you're constipated? That's exactly the same mechanism for pushing in pregnancy. And I find it so interesting. Even my students who are physical therapists, a lot of them can't figure out how to push on their back. But yet 95% of birthing people are on their backs.
So fascinating to hear all this. I had a ruptured appendix in between my first and my second.
Yeah.
And I so wish I had known that information and come and seen you in between our first and second baby.
Yeah. Did you notice a difference in your birth of your second?
The first one was pretty hard. I did 2 home births.
Okay.
And the first probably took 35 hours and the
Yeah.
second probably took 24 hours, but
Okay.
it was a second baby. She made her way out, but I imagine I could have shortened my labor and that would have been really lovely for everyone involved, especially myself and our baby. And then just even having that information prior to pregnancy, even knowing that you can set yourself up for an easier birth, for an easier experience, for potentially less intensity or pain
Yeah.
during the birthing process. I never heard that ever.
Nobody has. And that's what I'm trying to get out into the world. This is what I want to change. I had a mom come to see me who wanted to do a VBAC. She had gone into labor with her first baby, 42 hours of labor, and ended up having a cesarean birth. And she came to see me, not even pregnant with her next one. I really want to have a VBAC. And when I assessed, her tailbone was sticking straight up into the pelvis at a 90-degree angle from where it should have been. And it was a roadblock that the baby's head was hitting, and there was no chance of that baby getting past it. Why did nobody see this? Why did we let her go for 42 hours of labor without recognizing that the tailbone was in the way? I'm like, nobody is looking at this information.
Yes.
And that's what a pelvic health PT, although I do want to clarify that someone who has trained with me, they know how to look for this more than just a traditional pelvic health PT. So they've taken extra training. Anybody who studied with me will know exactly what I'm talking about and be able to support you with what I'm sharing today. Nobody's looking at it, Stephanie. We are concerned about head down. So, yay, we're making progress. Gail Tully of Spinning Babies has done a fabulous job of getting information out about how we can help position baby better and getting the idea that, hey, we need to understand and know where baby's position is in the belly. And so I would love more doctors and midwives to understand that if that baby's head is not directly midline, there's some restriction going on there. And what I find is that if we have tension in the pelvic floor muscles on one side, the baby's head goes to the opposite side. If we have tension bilaterally in the pelvic floor muscles, baby's not engaging into the pelvis. So there's babies that are sitting really high and they never really engage. There is a restriction holding them up.
What do you think causes the restrictions for people?
That's why I say that your labor is dependent on what you bring in your body to the birth.
Hmm.
So if you've had any abdominal surgeries, if you've had any injuries and falls and impacts, I would really want to look at people who've had really painful periods. The uterus needs to expand and contract, which means it grows 10 to 15% in size every period and then shrinks back down again. If that's crampy and that's really painful for you, that's telling you your uterus cannot expand and contract easily. So there have been a lot of times where clients come in and they're on their period and yeah, I'm really crampy. By the time I'm done releasing the uterine ligaments and the uterus and get it moving normally, they leave with no crampingness. Now, there is a thing of endometriosis, and that's a whole nother issue. But if there's restrictions in there, which a fall on the tailbone, a fall on the buttocks, the uterosacral ligaments attached to the sacrum. So if you've fallen and injured yourself, and I have to say, every day I am getting more and more aware of even injuries in the leg, an ankle sprain, a knee injury, knee surgeries. Those really do impact the abdomen. I was working on one pregnant client. Her right lower abdominal area was just super tight and it wasn't releasing. It wasn't releasing. And as I was working on it, I'm like, wow, this is just really tight. And she goes, I broke my ankle last year. So I kept my hand in that tight tissue in her lower abdomen. And then I just put my hand on her left ankle where she had fractured it. And it helped the tissues to melt in her abdomen. There's always a connection in the body. And just this week, I was working with someone who had a lot of tension in her pelvic floor muscles. And as I was working with her, I'm like, have you ever had any leg injuries? And she's like, I've sprained both of my ankles. And I kept a finger internally on the tight muscles that didn't want to release. And I just put my hand on the ankle that she had sprained, and it helped the tissues to relax and release. So those twists, those falls, those injuries, those surgeries, they impact up the chain. Our body is a chain of links. And if one link is not happy, it can affect the links up the chain. When we have babies who are position breech, the most common position is for that baby's head to get stuck on that right side underneath the ribs there.
Mm.
And usually that's correlated to left side knee and ankle injuries.
Oh, wow. Okay. And do you have classes for expectant parents to put out this information?
I don't have any scheduled currently. I do offer them for my pregnant mamas because I just want to teach them how to push and then help them to understand ways to get their body in shape for birth. It is a marathon of a birth. that we are going through. It's a long process, birth can be. And so I feel like we need to be able to prepare for it. I do have a free course. I used to teach it a lot more frequently. I will have it on my website at some point. I need to plan that and do it. I've been busy with creating an online course and doing an online summit that I do every April. And so we're just coming out of that, catching our breath.
So, Lynn, you mentioned a common birth pattern that you found that shows up in the pelvis after birth. What can you share a little about that?
Yeah. So what happened was when I moved from Seattle to Boulder, I had to start my practice all over again. And I was teaching free classes to postpartum mamas called How to Lose the Postpartum Pooch for Good. And I was just seeing new postpartum moms in my clinic practice. And we need to understand that when you go to a PT clinic, they're seeing a little bit of everything. They're seeing all stages, all ages, all different issues. And when I started my practice in Boulder here, I was just seeing postpartum moms. And I started noticing these patterns. They would lay on my table and their pelvis was be rotated to the left. And I figured out that, oh, their sacrum was in this position. When I correct this position, their back pain went away. And they'd been seeing chiropractors and massage therapists for months because of this back pain. And in 5 minutes, I had them out of pain. And so I started getting really curious about what's creating this rotation in their pelvis. And so I was really palpating the pelvis and I started noticing all these different patterns. We know that the bones of the pelvis have to widen for a baby to come on out. So your sit bones, the bones that you're sitting on right now, if you're sitting, they have to widen for a baby to come out. Your tailbone has to lift backwards for a baby to be born. And if your baby comes out in a beautiful position, depending on how big the baby is, your pelvic bones don't have to open up as wide as if the baby comes in crooked or comes in posterior, so sunny side up. If a baby comes in that way, the pelvic bones really have to open up much wider than they're physiologically able to. So I started noticing that the bones of the pelvis were wider and they weren't coming back together to their original position. So I would find their sacrum would be stuck in flexion. I would find their sit bones to be splayed apart. And sometimes, depending on their position they were in when the baby came out, one side would be more splayed out to the side than the other. And so I just started noticing this in my postpartum clients. And then I started seeing it in every single postpartum client. And I started putting two and two together because I understand body mechanics as a physical therapist. And so if a mom labored on her left side, the left side of the pelvis is anchored to the bed, so it can't move. So the top part has to move more for a baby to come on out. And so I would then find that top part, that ischium would be more splayed out to the side than the other. And when I would help bring those bones back together again, their back pain, their pelvic pain would go away. The pelvic floor muscle function would be much better. It just helped so much more. And I am astounded every day in the clinic how much change I can make in getting the pelvic floor muscles to function so much better in one session.
Hmm.
So it's like the pelvic floor muscles get so stretched out when that baby comes on out. Plus, if you tore or they did an episiotomy, now we have scar tissue in there. And scar tissue isn't as flexible as normal tissue. If any of you listening into this and you really have to effort to get your pelvic floor muscles to contract, that's too much work. There's something going on that is inhibiting those muscles from being able to just turn on, turn off, like opening and closing your hands. It should be that quick in your ability to make your pelvic floor muscles turn on and turn off. But a lot of times after birth, it's not that. It's like you have to really think and really effort to get them to come to the party, get them to contract and get strong. And once you've had a baby, once you're postpartum, you are always postpartum because your body has changed and that can stay in the body forever. I was seeing all these postpartum moms found all these different patterns in the pelvis and in the rib cage and the belly, in the pelvic floor muscles. And I went back to Illinois to visit my family. And I was working on my aunt who had a 47-year-old son at the time. And I'm like, your pelvis is exactly like all my young postpartum clients. When I asked her about it, she had a horrifically traumatic first birth, and her pelvis was still stuck in that open birthing pattern. So pelvic bones being in what, happens during birth, I'm now coining that the open birthing pattern of the pelvis, because the pelvic bones do not always return to their original position after birth. And it can remain in our bodies forever. I had
So
one.
it's never too late
It's
to come
never
in.
too late. No, I had a mom that was like 67 years old, and she came to see me, and her pelvic floor muscles, they felt like cardboard. They could contract, but not really well. And then I worked with her and I'm like, oh my gosh, she's stuck in this open birthing pattern. So I brought her sacrum forward, brought her ischiums together. And then her pelvic floor muscles just had normal strength again. She was 67 years old at this time. So it's never too late. My hope and dream is to have birth healing specialists in every city in the world to get these ideas and this work to as many practitioners' hands as possible so that moms can get the help and the support that they need and deserve after having children. Because my aunts are coming to visit me and they're in their 70s, and now they're both thinking they need prolapse surgery. I've been doing this work long enough now that when I get a pregnant person in, I'll explain to them, I really want to see you afterwards so I can help get things back together again. Your abdominal muscles and your pelvic floor muscles get so stretched out after having a baby. And your core strategies can be problematic down the road if your upper belly is tightening more than your lower belly. Your lower belly needs to tighten first when you go to do your core, and that needs to draw in. If you cough and you put your hand on your lower belly, it should draw in and not push out. A lot of people are pushing out. That means your lower belly is not coming to the party. And all of that needs to be helped and worked on after birth. It's my dream and goal that everybody comes in and gets a session. In France, they get 8 physical therapy sessions after a baby. I now had women that I've seen during pregnancy, they will come to see me postpartum, not having any symptoms, but yet their core still can't function well. It's okay. But after having a session with me, it works so much better and easier. It needs to be easy, an easy contraction, an easy relaxation. If it's anything but that, there's something going on. There's something being held in those tissues. And if your bones are in that open birthing pattern, your pelvic floor muscles are hanging on for dear life, trying to pull them back together again. Practitioners, pelvic health PTs, who don't understand how to work with the bones of the pelvis first, they may go in and release those pelvic floor muscles without addressing the bones, and your pelvic pain gets worse because they're not addressing the reason why those pelvic floor muscles are tight in the first place. And that's because they're trying to hold your bones together.
So
And they're,
it sounds like this is really necessary. It's not
yes,
just like a bonus. It might be nice to get a postpartum massage or something like that. This is necessary for your body to function properly for the rest of your life.
Stephanie, you nailed it on the head there. Yes, it is so important, whether you have symptoms or not, to come in and see one of my practitioners who is trained with me. I have a directory on my website. We'll put it in the show notes. Check out that directory and go see someone. Like you said, this is not a fluff thing. This is a necessity after you have a baby to be able to function well and not pee your pants when you're 70 years old, to not have your pelvic organs falling out when you get older in life. It's not okay. And you can get help and support and prevent all that by just having a session or two with a physical therapist after birth.
We've been speaking today with Lynn Schulte. She is a pelvic health physical therapist for more than 30 years. Lynn, can you share how people can get in touch with you if they want to learn more about your work?
Oh, thank you, Stephanie. For those practitioners listening in, if you have a license to touch or you want to check out my online and live courses, you want to go to the instituteforbirthhealing.com. That's my website for my educational platform. If you're interested in coming in and having a session with me, and that session can be done in person in my clinic in Longmont, or I can do live virtual sessions with people if you're dealing with trauma from birth or you want to work more energetically with your body. I can do a session via Zoom. And that you can sign up for and schedule an appointment with me via the centerforbirthhealing.com. That's my clinical website. And then all the social media is the Institute for Birth Healing. My YouTube channel, where all my videos are and educational videos are, is on my YouTube channel, Institute for Birth Healing.
Thank you so much for being here today, Lynn. It's been a real pleasure to speak with you.
Thanks so much, Stephanie, for having me. And thanks everybody for listening in. Please take care of your bodies.
Thank you so much for listening to the Prepared for Parenthood podcast today. I hope you found this episode educational, informational, and conversational, and that you'll join me again for another episode soon. If you enjoyed listening to today's podcast, I'd very much appreciate if you would rate, review, and subscribe. If you're interested in more information related to today's podcast, or are looking for parent coaching or courses, you can find my information in the show notes or online at preparedforparenthood.com.